Welcome back to All Women. I'm very, very excited about our next guest. It's Dr. Leila Sadien, a GP, medical doctor, an integrated medicine specialist, did I get that correct? And an aesthetic specialist. So you've got everything in one doctor. And we were going to start the show talking about thyroid issues because I have got an underactive thyroid and Kia has an overactive thyroid.
That's
So
right.
we have two sides of the coin.
And I had an underactive and overactive.
Wow.
So we've got all sides of the coin.
She's such an overachiever.
I know.
Leila, welcome to the show.
Thank you.
I thought we'd start at the very beginning. What is a thyroid? Where is it in your body? How does it work? Why are so many people getting these crazy things?
So a thyroid is a gland. When we talk about glands in the body, they are things that produce hormones, usually in response to being stimulated by the brain. So the brain will send a very specific stimulator to, for example, the thyroid, and the thyroid will then release the hormone, which will then go and travel through the bloodstream to find its site, so wherever it's active in the body. Pretty much almost every cell in the body has a receptor for thyroid hormone, which isn't true for all glands. So glands don't have a function everywhere in the body, very specific places, but the thyroid is specific for everywhere in the body. And where it is basically just over sort of around this area.
So if I am looking at my body and I am checking in with myself, what kind of symptoms, what would I be looking for that would push me to come and see you to get help?
The thyroid gland, one of the big things about it is it controls your metabolism. So when you're overactive, you feel like hyper and you lose weight. One of my first symptoms when I had an overactive thyroid was this bizarre anxiety. I was anxious and I had no idea why, and it wasn't who I normally was. So it's a deviation from the norm. If you're feeling anxious and you know exactly why you're feeling anxious, then that's another story. When I was at campus, it was the one disease I wished for. Because I was like, I wish I could have that. And then I saw the googly eyes and I was like, maybe not. It might not be worth it.
Yes, and you get that flutter inside. But the underactive thyroid is a little bit different to the overactive
It's
one.
the opposite. So exactly the opposite.
Yeah.
You're lethargic, you pick up weight. The metabolism is horrible. Exactly, like every woman who's overweight will go to a practice and they go, please God, tell me it's my thyroid. Because then we can fix it, As a woman after pregnancy is a good time to kind of check in with your body. Something doesn't feel right after pregnancy, thyroid is a common thing that can go wrong then. And then after an intense period of stress.
Right.
Brain fog and sort of mental acuity that doesn't feel right. Big thing is the hair and the nails.
Okay.
They're very early changes actually. So when your nails start, your nails should not be breaking.
Sure.
Something's wrong.
And would you say more women than men?
Fundamentally.
Or really?
Absolutely, by far. One of the biggest things is that this disease of modern living called stress makes our bodies make cortisol. And cortisol inhibits the thyroid from producing thyroid hormone. Or it changes the conversion of inactive hormone to active hormone, and so we're not getting active hormone. And so stress is fundamental, and I think every person here knows exactly what that feels like. And we all, as people who live in this modern life, experience stress all the time. We forget that it is a chemical response happening inside our bodies. When we are releasing cortisol during our stress, it's destroying everything. So that's one big reason. So clinically, when the patient walks in, they will tell you, I'm fatigued, I'm picking up weight, I'm swelling, I've got puffiness, all this stuff. My hair, my nails aren't great, the whole story.
Sadly, I know the story.
We know the story. And then we do some blood tests. So when I was a conventional GP, it would be very simple. You check for, is the brain stimulating the thyroid? And it's a level called TSH. And if the brain is trying too hard to stimulate the thyroid, then the thyroid isn't working properly. And then understood that actually that wasn't enough. You needed to also check, is the thyroid still doing what it's supposed to do? And then even more than that, we start testing different levels of what the thyroid pushes out, because the thyroid doesn't just push out something called T4. It pushes out T1, T2, T3, and T4, actually. And just because medicine knows that T3 is the most active, that's what we think we should be looking for. But the other thyroid functions are real, and you will feel them if you're missing them. So we try and test as much as we can, and we're not looking for what's in the normal range, we're trying to look for what's in the middle. You know, what is ideal? What is optimal? Because you could be in the normal range, but you're still feeling under.
Yeah.
Does that make sense?
Yeah, I mean, for me, with having hyperthyroidism, I didn't pick it up for a while. I mean, I gave birth to my second child, and then my levels were tested because I started getting also lethargic as well. But I've got like high energy, but I feel almost like I'm crashing. I know people say to me, that's why you're so thin. It's because you got hyperthyroid.
You should be grateful.
I said that to you.
She did.
Grateful, be grateful.
And it really it wreaks havoc in your life.
Yeah. It
Every
does.
day waking up with that fog, you feel like you are a non-participant, but you're doing everything possible to be like this active person that's here, that's in the now, and you're not.
That's
Absolutely
a really
not.
good way of putting it. You feel like a non-participant. You feel like like in the back seat of your own life.
Yes.
You're not driving it. You not like.
Here's the fog, and here you are, and you're kind of like that's literally my feeling. Yeah.
And the problem is a lot of illnesses make you feel that way. You know, it could be diabetes, it could be chronic fatigue, whatever. But we're made to believe that that's just life or old age.
Old age.
You know.
Yeah.
So those are the kind of things that integrative medicine really has a great hold on. Is when you're not quite sick, but you don't feel like a human being.
Yeah.
Deviations from the norm, which is what you mean. And in terms of that, I mean, if you were to guide someone into that frame of mind, where would you start? Because a lot of people are very, I would say, they're not that open, to the information, and they're kind of like, oh, please, I must change my diet. What's wrong with my diet?
So when we talk about integrative medicine, we're always talking about what is the fundamental cause of why your body broke in the first place. Where did it come from?
Yes, the source. Yeah.
Absolutely. So when we talk about your diet, it's not just, well, one size fits all. Your diet and your diet are going to be very different because the causes of your illness are very different. Yeah?
Yeah.
So when we talk about thyroid, there's one part that we must always mention is this aspect of autoimmune disease. The immune system starts to fight the body as if the body is an invader, right? So that's manic. I mean, how does that make any sense? The first time I heard it at med school, I was like, this is insane. Why would God create a body that does that? And only maybe 20 years later, I found the answer, that we are actually causing it ourselves through the food we eat. So autoimmune thyroid issues are rife. And if we know that it's autoimmune, then our diet is focused predominantly at treating the autoimmunity aspect. The other reason, which of course I'm always going to come down to, is nutritional deficiencies. And thyroid hormone is made from something called iodine. And so we're not getting enough iodine in our diet. In fact, it's been happening for such a long time that America, being the first country that does anything, decided to put iodine in salt because people were eating salt, and so it made sense. So all good and well, except then people got high blood pressure. So now we don't eat much salt. And so the iodine that's in our salt is not nearly enough for our nutritional needs. And then the other thing that was really fortifying us was the iodine in bread. So they used to put iodine in a conditioner for bread. And the problem is in this country, they've changed the iodine to something called bromine, which inhibits iodine absorption in your body. It's another big problem. Almost everybody that I test is iodine deficient. And so, of course, we're not making enough thyroid hormone. So those are two reasons. I mean, I could go on forever. There are lots of drugs that inhibit thyroid function. I mean, it gets crazy.
What would you do to treat somebody who came and presented with this problem?
So as a conventional doctor, I have to give the medical aspect as well, which hopefully we resort to at the very end if we need to. It isn't first line at all. If you have an overactive thyroid, the question is, do we ablate it? So we give you radioactive iodine and it destroys your thyroid. Do we surgically remove aspects of it? Do we give you drugs to stop it from overacting? So that's the medical version. It's quite scary. The underactive side from a medical perspective is usually very simply giving you synthetic T3, right? So from an integrative perspective, number one is going to the cause, which we talked about before. And so you supplement with iodine, you work with the autoimmune, you do what you need to do, and we can actually stop the autoimmune process. So you stop the immune system from fighting the body. And then to actually give you back your thyroid function, my favorite drug is a glandular, which means it's been taken from an animal's gland, and it consists of the whole, every single thing that the thyroid makes. So instead of just T3, it's T1, T2, T3, T4. before.
All of them, okay.
And the animal that we take it from is a pig, so it is as close to human as possible, believe it or not. You know, pig kind of physiology is very similar to humans. And so people who've been on the ultroxin or the drug versus the pig hormone, they say that somehow they just feel more human than they did before.
Wow.
Something was missing and now it's back. So that would be for them. My favorite medicine for overactive thyroid is an amazing medicine from China herb, actually. So it's a Chinese herb blend, and it's called Thyroid Through. And you take it for a period, and every single overactive thyroid patient I've had has been cured with that medicine. So that's what we do.
Leila, thank you so much
so
for coming
welcome.
in. Obviously, we're going to have you back
Thank
many
you.
times. We've got
Thank
so
you,
many things
thank
to
you,
talk
thank
about. We definitely hope it's the first of many.
I hope
Yes.
so too. Thank you for having me, ladies.
you. Thank you.
Welcome. Stay tuned for our next guest and keep watching Oh Woman.